Okay, this presentation is on the deaf and hard of hearing environmental and cultural factors. Starting off with the media, they often represent an inaccurate representation of the deaf and hard of hearing community. They use phrases such as deaf mute, deaf and dumb, and hearing impaired. Hearing impaired is offensive to those in the deaf community, and they prefer deaf or hard of hearing. Also, roles where the characters are deaf and or hard of hearing are usually played by hearing actors. The deaf community is upset by this and would prefer that more deaf actors play these roles because they know how to accurately represent the community, as well as just in general have more accurate representation within the media. Family support is very important. Studies show that early communication and support is vital for the children to help develop emotional stability later on in life. Also, if parents are involved in the child's learning, they participate more actively within school. Also, the deaf community doesn't see their deafness as a disability, rather as a difference, and that empowers them and creates a bond and makes them stronger. For families that choose to use and teach sign language to their child, they can arrange to have interpreters present at important events, graduations, funerals, announcement type things, anything like that, so they don't feel left out and feel more included. Role of peers is also really important. Deaf children, especially if mainstreamed, may grow up feeling really different, especially when their peers ask them why they have a cochlear implant or why they are wearing hearing aids, or just in general why they can't hear. Therefore, it can make it harder to form friendships than their hearing counterparts. However, children will always find ways to communicate, especially if it is explained to them that this person can't hear and this is how you get their attention and this is how you talk to them. Friendships can still be made. Is deaf culture kind of a cyclic in nature? Overall, yes. This is mainly due to the fact that about 90% of deaf children are born to hearing families who have never experienced deafness before. Therefore, families have to decide how they want their child to learn communication. Are they going to have their child be mainstreamed and learn oral communication by going through speech therapy? Or are they going to have them, they can still be mainstreamed, but have them learn sign language and use sign language and have English as their second language? And there's also different types of schools that they have to decide to send their child. So residential schools are a place where they have to send their child kind of away for the school year, and they use sign language there versus oral communication. Typically, mainstreamed deaf individuals will be using like lip reading or an interpreter, but they go to a hearing school. Most of the other students at the school are not deaf, they are hearing. So the legal/political system. The legal system hinders a lot of deaf individuals mainly due to the lack of communication. And with police officers, they weren't really trained on how to communicate with deaf individuals. However, the ADA has now made requirements for police officers that has or will improve communication with deaf individuals for certain arrests or within the jail system as well and within the courts. So they are now required to provide interpreters. They have to use a paper and a pen. For people who are hard of hearing, they can use amplification systems that make it louder so they can hear. They can use also a teletypewriter. This is more than just with police officers, it's within the courts, it's within jails. And this is just to give them access to communication so they can understand what is going on. However, there are certain scenarios when they do not have to provide interpretation. It's mainly when they themselves, the police officer, or anyone else is in danger. They don't have to provide interpretation in those scenarios. What are some potential cultural environmental barriers. So the deaf community may not accept those who are deaf but don't sign, or those who do use auditory aids like a cochlear implant or hearing aids, especially if they don't sign. They may not truly be seen as a member of the deaf community. There's a lot of ineffective communication within healthcare. A lot of the times, even though interpretation is available, it's not very utilized by healthcare staff. And there's also a societal stigma that hearing loss is a disability, and those who suffer from hearing loss are unintelligent and can't learn. That is not true. Sign language is also not really seen as a language. It's kind of seen as like a movement version of English. However, sign language is completely different. It's its own language. It has its own grammar and completely unrelated to the English language. And internationally, what are kind of some of the environmental things? So overall, education is pretty limited for the deaf community, and about 80% of those who are deaf are uneducated, most of them being females. It's also more difficult for deaf individuals to obtain work and be able to get a job. Many also don't graduate from universities, also contributing to a harder time getting a job. Many experience discrimination, and some are even, in some countries, prohibited from marriage, owning any property, from voting, or even having children due to the fact that they are deaf. So how can social economic affect their health? It can affect their access to certain medical procedures and or education. So if they're in the lower class, it might be harder to be able to go see the doctor and maybe get an operation for a cochlear implant or just health in general. They also have decreased overall knowledge and decreased health literacy and are less likely to understand what is going on if they do go see a provider. How can race/ethnicity kind of affect their health as well? So members who are of minority, African Americans, Asians, and Hispanic individuals may experience increased discrimination due to them being a different skin tone, as well as being deaf or hard of hearing. There's also discrimination within healthcare for those same reasons, and it may increase their healthcare barrier in receiving proper care. Their psychosocial health is also at an increased risk for them feeling isolated and maybe having an identity crisis. And also they have an increased risk of bullying as well. How can religion kind of affect someone's health? So religion kind of plays a large role in one's perception of their own health or influences on their actions. So depending on their religious beliefs, they may not seek treatment, or they may think of themselves or people similar to them differently than people in other religions. And some may feel that God is punishing them and their punishment is being deaf, which can also lead to feeling isolated or just feeling different from their peers. How can gender kind of affect health as well? So females are at an increased risk of not being educated, and also there is an increased health risk for those who are also deaf and identify within the LGBTQ plus community. Men are more likely to be born deaf or experience hearing loss than women. However, women tend to be more vocal about it and kind of more direct in explanations than men do. How does their geographical location also affect their health? So this could affect their ability to have an on-site interpreter if they do go to like a clinic or a hospital. And there might not be effective interpretive services available in rural areas just because of lack of funding or lack of individuals within that community that speak that language or that need sign. Telehealth is available for the deaf community and would be a great way for them to kind of seek care in these rural areas. There's about 4 different ways that they can do it. They can have the doctor and the interpreter on the same screen, and if they would like to, they can add captions at the same time. And then another way is to have the doctor on the screen along with captions, and then there's the third option is having 2 screens, and one of them has the captions with the interpreter if they want, and the other screen has the doctor. And then there's a video relay services or caption telephone services that can be used to make a call as well. So what are some implicit and explicit biases? Overall, they're pretty much the same as deaf people being viewed as unintelligent and disabled and implicitly unable to function independently. Internationally, communication is the biggest barrier to accessing healthcare. And general knowledge about deaf culture is very limited worldwide. A lot of people don't understand or recognize deaf culture as their own. Interpretive services are underutilized even when they are available, and they use improper interpretation by using family members instead of certified sign language interpreters as well. And these are my references. Thank you.